Hi everyone, I hope you can hear me. The fans are on in the room because we got home and it's really hot. I didn't want to do my update like this. I and Alan's been producing a thank you video to everyone that left messages on I think I am pregnant, and it's positive, 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 I am pregnant video. This is going to be a very, very candid and very open video. Alan's right here. He wants to smile and say hello.
Hello.
He said he would stay up so that he could do this video with me. Okay, so if you have children in front of the computer watching this, you might want to have them excuse themselves out of the room, because I'm going to be very upfront and honest, and this is mostly for our journey to keep pattern. And I told the doctor we were video vlogging.
Don't get too.
I won't get too personal. Sorry, my hair is just can you tell my hair is getting dark blonde?
No dying.
I can't dye my hair, so as you guys can see, I'm dark blonde typically.
No, it's sad.
Sandy, yeah. Yeah, there's my arms. Ain't that lovely? Yeah. Yeah, I can see exactly where my arms are, exactly where my extra skin is.
Okay.
Okay, getting to the point. Oh, my hair.
Don't worry your hair.
Okay, so we had relations, intercourse, last night, and when I was cleaning up and going to the bathroom, I started bleeding. Of course, we know now this is normal. It was not blood from up inside of the pregnancy, up inside me. It was just irritation in the vaginal canal. It was very light. It was just two little streaks when I was cleaning up, and that was it. But it freaked me out enough to call my doctor's pager. He called me back. Now, mind you, we were not supposed to see the doctor until August 31st for our first OB appointment and our first ultrasound. But because they are considering me high risk because of all the stomach surgeries I've had, the weight loss surgery, the polycystic ovarian syndrome, he left it up to me to be seen today. And he only recommended it if, 1, I continued bleeding, 2, I had severe cramping, or 3, I just wanted peace of mind. So the bleeding stopped. I did have some cramping today in the lower back and my pelvic area. Not bad, just your typical cramping. But 3, I did not have peace of mind. So I still wasn't going to do it. I was going to wait until Monday. And I talked to Alan and stuff. And it was just ironic because when I talked to the doctor, he was home and he didn't have my chart. And he had never seen me before. So it was just fantastic. He took my phone call and called me back. So they called today on the other line when I was talking to Alan, and they told Alan, or they told me that because Dr. Wyrick was in the office and he wanted to see me anyways because of all of my history, the weight loss surgery being, by the way, the 23rd, I was 22 months post-op. So anyhow, they wanted me to come in today for just a 15-minute appointment for an ultrasound to make sure everything was vital, meaning alive. So I went in, Alan went in, and we had no choice but to take Spencer because my parents are gone. And praise my sister, my brother-in-law, and her kids. My brother-in-law went to Missouri for 30 days for training, and then they're shipping him to Iraq for a year. So please pray for him and his safety, and my sister and her family for this time of transitioning. So we went and we went in there, and he talked to us about seeing how far along we are. He said, I don't want you to get your hopes up because you're still pretty early, but by 6 weeks we should be able to see a heartbeat. And I'm like, okay. And so but he's like, if you're earlier than that, I'm not going to be able to tell you. But in some weight loss surgery patients and women that have had abdominal surgery, we sometimes see the heart sooner than that. but I've only seen it really in these cases. And you would be my 18th weight loss surgery patient. And I'm like, okay. So, of course, I lay down. It was a vaginal ultrasound because I was so early. And I lay down, and he's moving it up inside me. And Alan and him are looking. And talking about evading the doctor's personal space, my husband was this close to the side of his face, staring at the ultrasound. And the doctor's like, a little close. You could just see it on his face. And Alan's like, what's that? This is what Alan saw.
No, I see more than that.
Not the first time. I'm going to explain why I only have this picture. The black spot is the baby. It's the
Pregnancy bag.
pregnancy bag. Yeah, the bag is the way we got it explained to us. But there's that. There's my... Do you guys see that? Probably not.
You can't see it because you got the wrong one.
Okay, anyways, that says my name, says today's date. And, well, you guys can pretty much see. Here's the pregnancy bag. Then he goes on further to the second picture where it shows half of that bag is a white blotch. And he's like, Alan's like, what's that? And he's like, Mr. Ratcliffe, that would be your baby. And he's like, wait, cool. And then right in he moves it around a little bit more, and then right in the center of that white spot was a flutter, and it was very, very, very tiny. Hardly could tell, but when you really looked at it, you could see it pulsating, going tick, 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 tick. And he's like, before I had the ultrasound done, I told him on the left side I was feeling a floop, floop, floop. And he's like, we need to see how far along you are. And I said, okay. And so he did it and everything. Second picture was the baby. Third picture was that. And Alan's like, what's that? And he's like, Mr. Ratcliffe, I believe that's your baby's heartbeat. He's like, but you just said that we're 5.5 weeks pregnant. He's like, you are. But in a lot of weight loss surgery patients, and in a lot of women that have just had abdominal surgery of any kind, they have found new research out that the baby, they are able to see the baby's fluttering of the heart sooner than 6 weeks, but that legally the FDA has not approved those findings, and that in 2.5 weeks he wants to make sure that that is what he's seeing. But we're in that gray area of it's a heartbeat, which we all know. He kept going wink, wink, and saying wink, wink. But then he turned it around, and I'm not kidding you. It was only like half a turn that he turned it to my face, and my husband moved his ass so fast around to by me so that he could continue to see the picture. So his eyes were on that picture the whole time. So when he moved this thing around, he started all over so I could see. Which first picture was this, and then it was a picture of half of this black was a white solid like round blotch. That was the baby. And then right in the middle of that blotch was the DTT. And I'm like, he's like, do you see anything? I was like, what is that right there in the middle of that white dot? He's like, well, this sounds like deja vu. That's what your husband just said. I believe, wink, wink, between 90 and 98% that that's your baby heartbeat. I can't tell you 100% sure because we just don't have any findings that, but every weight loss surgery patient I've had, this has happened. And everyone but one, I think he said, where it's early. Not only that, he said that weight loss surgery patients can feel things, or abdominal surgery patients, women, can feel things a lot sooner than women that have not had any kind of abdominal surgery. So that's kind of cool. I'll probably feel things more. But in 2 weeks, we'll have another ultrasound, and 2 to 2.5 weeks, and everything should be fine. I'm going to continue my appointment on Monday, and just to go over all of my social history and Ellen's, and we should be good from then on out. So thank you for all of your prayers, and we'll do that bigger update video and thank you video on Monday. Bye. God bless.